Bismillah ar-Rahman ar-Rahim. Management of upper airway obstruction. In a case of upper airway obstruction, we should call for the senior anesthetic help early. Open the airway with backwards head tilt and chin lift, and forward jaw thrust. Forward jaw thrust. And in cases of trauma, don't tilt the head in case of cervical spine injury, but perform a jaw thrust only. So again, in a case of upper airway obstruction, we should call for senior anesthetist help early, and we should open the airway with backwards head tilt, chin lift and maneuver, and forward jaw thrust. And in cases of trauma, we should not tilt the head, as for example in case of cervical spine injury, but perform a jaw thrust only. If unsuccessful at restoring normal respirations, visually inspect visually inspect the mouth for obvious obstruction and remove it with a finger sweep. Be mindful of not pushing any obstructing matter further into the airway. Leave well-fitting dentures in place. If there is a witnessed history of shocking and the patient is conscious, consider performing 5 back blows followed by 5 abdominal thrusts if unsuccessful. If the patient is unconscious and no signs of life and no spontaneous respiratory effort, start resuscitation. Insert a laryngeal mask or consider anesthetic or intensive care unit placement of an endotracheal tube and deliver O2 via self-inflating bag with supplemental oxygen 15 liter per minute and reservoir bag. If not breathing and cannot be ventilated, a cryothyroidectomy may be necessary. So again, if the patient is unconscious and no signs of life and no spontaneous respiratory effort, we should start resuscitation. We will insert laryngeal mask or consider intubation and giving oxygen via self-inflating bag with supplemental oxygen of around 15 liter per minute and reservoir bag. If not breathing and cannot ventilate it, a cryo a, a cricothyroidectomy may be necessary. Suction out secretions is very important. Maintain circulation with cardiac compression if necessary, and seek definitive treatment for the cause of airway obstruction.